Welcome back to Living Local. According to the National Children's Alliance, the most recent data shows that nearly 700,000 children are victims of abuse each year in the United States. Here in the Quad Cities, local organizations are working proactively to prevent child abuse while prosecuting offenders and providing treatment for victims. And joining us in studio today is Katie McCory with the Child Abuse Council. Thank you so much, Katie, for coming on.
Thanks for having me.
So let's start off with the mission of the Child Abuse Council. What is the mission?
Yeah, the mission of the Child Abuse Council is to eliminate child abuse and neglect, and we do that by providing programs that strengthen children and families, that focus on treatment, education, and prevention.
Okay, and we're highlighting one of your valuable resources today. What is the Mississippi Valley Child Protection Center?
So the Mississippi Valley Child Protection Center is an accredited child advocacy center. We're one of 6 in the state of Iowa. You can find child advocacy centers in every state and some internationally as well.
Okay, so only 6?
6 in Iowa, yeah. Some states have a lot more. It really depends on population, and we all kind of structure our services a little bit differently in every state.
So how does this program address some of the needs of the victims?
Well, our primary goal is actually to provide a coordinated response. So we work really closely with a multidisciplinary team of professionals in the community. That includes law enforcement, prosecutors, Department of Human Service workers, mental health providers, medical providers, education professionals, just a lot of different disciplines. We work together to really coordinate our response, and we implement a team approach when these cases arise.
Yeah, it kind of takes a community, right?
It
a
does.
Village.
Right, absolutely, yeah.
So let's talk about this multidisciplinary approach.
Yeah.
Does that yield, better results?
Absolutely. So when we work together as a professional team, we're really bringing our individual expertise into these types of situations. And our primary goal is to make sure that the children and the families are at the center of our services. So we're working closely by sharing information. We're coming up with a team approach to what kind of recommendations we have. And we really hold each other accountable to do the best job in our own unique disciplines that we possibly can.
A lot of communication.
A lot of communication. We have a lot of team meetings. Yeah.
Yeah. That's the key. So let's talk about some of the services. Tell me about some of the services provided by the Mississippi Valley Child Protection Center.
Yeah, so we provide a unique set of services that you're not really going to see anywhere else in the community. We do forensic interviews, which is we talk one-on-one with children when these types of child abuse cases come up, and our goal is really to ask children questions about their abuse in a child-friendly way, a trauma-informed way, a way that's legally sound and defensible in court. We provide advocacy services as well to support the child and family throughout their experience after the abuse is alleged. And then we also have special medical professionals that are trained to collect evidence and ensure that the child's safe and that they're healthy. We also have a new service set that we started about a year ago, and so we're focusing on, we have a family navigator that helps provide services for children that have been exposed to alcohol and dangerous substances.
Oh, goodness.
Yeah.
So, during this pandemic, have you had a lot more cases? Because we have a lot of families that are home, still home, and a lot of kids are home more so than they were, a year ago when we were sending them to school full time.
Yeah. I think initially, I think what happens is a lot of the people who report child abuse cases are educators. So when this first started happening, we had a lot of children not in schools, and they're home, sometimes home with their abusers. And so Department of Human Services did tell us that they had a little bit of a dip in reporting, but I think now that children are engaging back in schools, we're seeing a consistent number of referrals coming through. So we're really not seeing a dip in services right now.
Okay.
Yeah.
And you probably work with a lot of the educators, right?
Yes, absolutely. Yeah.
And you provide information as far as what to look for and things like that for for teachers or other educators.
Yep,
right?
We conduct trainings for teachers, mental health professionals, special groups. Anybody can call us and request for those trainings. Yeah.
So these services that you spoke about, how do families access these services?
So I mentioned our Child Protection Center, and then I mentioned a special service that we started a year ago with the substance abuse programming. Our forensic interviews, our advocacy services and medical services can only be accessed when there's an active child abuse investigation happening. So only Department of Human Services and law enforcement can refer children and families into those services. But the substance abuse related services focuses on conducting comprehensive evaluations and assessment services for children to assess their cognitive delays, developmental delays. Anybody can refer into that service. So anytime a foster parent or even a primary parent who's going through substance abuse treatment, if they have concerns about their child, they can call our center and we can get them connected with the family navigator. Yeah.
So good. So many services.
Yes.
Now, you know, when we think about red flags of child abuse, I think a lot of folks think of physical abuse, because I guess it's easier to see. Yeah. Because it's right there in front of you. But that's really not the case. There are so many other forms of abuse. What are some other red flags for child abuse?
Yeah, the primary form of abuse that we really see in the United States is neglect, and that one's kind of hard to recognize. And the most vulnerable population is 0 to 5 in terms of that type of abuse. But we're really looking at medical concerns and dental concerns that aren't addressed. If there are medical conditions that parents are made aware of and they're not taking care of those concerns. If we have, sometimes we see kids that are truant from school without any reason. With neglect too, you can see kids that aren't wearing clothing that's appropriate for the weather, poor hygiene, physical abuse you'd mentioned, bruises, marks, injuries that are not explained, or the story doesn't match up with the injury. So there's lots of different things that can be red flags, but I think what's most important is to, some of those things can be explained by other conditions or other circumstances, but if you really have concern, it's important to bring it up. And really, when you're having those concerns consistently, or maybe coupled with lots of other concerns, I think that's important, and that should really raise a red flag to you.
So what should someone do if they suspect child abuse?
You should always report. And I think people get a little apprehensive about that because they don't want to falsely report, but reporting out of a valid, true concern is never a negative thing. So you're going to want to report to, if it's Iowa Department of Human Services, they have a child abuse hotline. You can find that number on our website. Illinois Department of Children and Family Services, they also have a child abuse hotline number, and you can find that on our website as well. And then call local law enforcement. I think some people forget to do that. Local law enforcement works really closely with the child welfare system, but I think it's always important to call both.
Okay.
Yeah.
Well, some good information, and thank you so much for the services you provide for our children and our families. Katie, thank you so much for taking the time to join us today.
Thanks for having me.
And if you want more information, you can visit childabuseqc.org, and we'll also have those details posted on ourquadcities.com.